All right, Dr. Schneider, let's begin with this new variant. I mean, we've been talking about it for weeks, but now we see it is very much the dominant strain here. Is this a point of concern moving forward?
Well, I don't think it's a point of concern where we should raise the alarm bells and people should start getting frantic and worrying about going backwards per se. I think what it does demonstrate is that this virus will, if allowed to spread, will continue to mutate because that's what viruses do. That's kind of their goal in life, is to just replicate, and if they replicate, they mutate. And it also helps to heighten the awareness that the virus is not gone yet. We're not out of the pandemic. We're still in a pandemic. We're in a different phase, thankfully. And I think we still can continue to really try to move forward now that the weather's getting warmer and we can get outside. I think there will be a lot of opportunity to be more normal. However, we can't just ignore that this virus has gone.
Oh, you look at the situation with the gridiron dinner, right? Trying to get back to more normal. First one since 2019. Vaccinations required, and yet it ends up being a super spreader event. And vaccine critics are pouncing on that, saying, look, it's not working. What's your reaction to that? Is that a fair criticism?
I think it's a partial criticism, and it's fair in the sense that we saw all these people who are vaccinated who got infected. However, we have to remember what the goal of the vaccine is. And the goal is to, yes, one, decrease the risk of getting infected, which we know it definitely helps. But more importantly is that it helps to really decrease the risk of severe infection, and it keeps people alive. There's a dramatic decrease in the risk of severe infection or mortality having gotten vaccinated. So as I understand the critics of the vaccine, I think it's really important to understand what the purpose of the vaccine is, and it's to make sure that if you do get it, just like the mayor, for example, he may have a little scratchy throat, that's all he gets, rather than dying, which is what we saw 2 years ago when people were getting this before vaccines were available.
Right. So to that end, even though we have the increase in cases, are we seeing an uptick in hospitals of any note?
Well, we haven't really seen a significant uptick yet in hospitalizations. If you look at CDC data, that actually hospitalization rates continues to go down as well as mortality rate. I think time will tell. We know that hospitalization rates and mortality rates always lag behind the increase of infection rates. And so we're hoping to not see a big surge like we saw with the original Omicron, the BA1 that we saw in January, where we saw a record number of hospitalizations across the country, including our own children's hospital. So thankfully right now we haven't seen that yet.
Is hospitalizations the better metric here in determining how serious this is, considering the fact that even former FDA Commissioner Dr. Scott Gottlieb this weekend said the real numbers in terms of infections are likely much higher than what's being reported because of all of the at-home tests?
Well, I think that's an important point. We look at the number of infections going on in our local infection rate, and we say, wow, now in Long Island, we're at 7%, and we were at 4% a week ago. Or that probably underestimates how many people are truly infected, right? Because we know many people are appropriately, if they have symptoms, they're testing at home, and if they're positive, they're not necessarily following up with a PCR, and the data may not get entered into the public database. So we're probably underrepresenting. But I think to your earlier question, the rate of hospitalization is critically important, right? I think we know how stretched we were as the healthcare systems, and hospital beds availability was really limited based on our earlier experiences. And so if we can keep people out of the hospitals, it obviously is a good thing for them with those who are infected with the SARS-CoV-2 virus. But also importantly is that it allows all the rest of the medical needs of the community taken care of. We can care for all the other illnesses that we struggled with, and surgeries that need to be done. Now we can do them because hospital resources are available.